Thank you all for joining us today for this Medicare webinar series and today's topic, Medicare options with Medigap and Medicare Advantage plans, presented by the Pikes Peak Area Agency on Aging. We want to thank the Pikes Peak Library District for its support of this webinar series. Before we begin, we ask that you please keep your microphones muted until we reach the question and answer portions of the presentation. You can then unmute, use the raise hand function, or type your question into the chat area to let us know when you have a question. And now it's my pleasure to introduce our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging. Roma, it's all yours.
Hopefully everybody received the email that I sent out about just a half an hour ago that included the slides and the handouts for tonight's presentation. If you did not get that email, type it in the chat box. So I will pause during the presentation to see if there are any questions. If you have a question, you're welcome to type that into the chat box at any time, and I will address your questions when I do pause for them, or when I do pause for to see if anybody has any questions. You can simply unmute and ask your question. So I think that's all the housekeeping I've got, so let's get started. So again, this is Medicare 101 Part 2. Tonight we're going to be talking about Medigap, also known as Medicare Supplements, and Medicare Advantage plans, sometimes referred to as Medicare Part C. As usual, we're going to start with who I work for, and I am with the Pikes Peak Area Agency on Aging, which is an organization that is designed to work with our partner communities that include El Paso, Park, and Teller counties to find systems and develop programs that remove barriers and allow people to stay in their homes for as long as possible. This is in partnership with the Pikes Peak Library District. We've enjoyed a partnership with them for several years now, and hopefully you found out about this presentation through the library. As Jared mentioned, I am the coordinator for the local SHIP program. The SHIP program, which stands for State Health Insurance Assistance Program, is a federally funded program that's designed to provide unbiased and free information and education on all things Medicare. This program in the Colorado Springs office of the Area Agency on Aging covers a total of 9 counties in Colorado. Counties are listed on the slide. Every county in every state has access to a SHIP counselor, if nothing else, a toll-free number. I've listed both our Colorado Springs number as well as our Colorado statewide toll-free number. If you call the statewide toll-free number, it'll route you to the SHIP program in the county closest to where you're calling from. So a quick overview of what we covered last week, which was Medicare A and B. We talked about costs, coverage, eligibility, and how to enroll for what's called original Medicare, the A and B parts of Medicare. And again, tonight we're going to talk about the other insurance options you have to go with your original Medicare. So the 2 primary options that we're going to talk about are, again, Medicare supplements, also known as Medigap, and Medicare Advantage plans, sometimes referred to as Medicare Part C. These are the options that are available to anybody who is enrolled in original Medicare. Both of these options are regulated by Medicare, and there are limited opportunities to enroll in these insurance options. And we're going to talk about all of that. And we're going to start with Medigap. Again, also known as Medicare Supplement Insurance, 2 terms that mean the same thing. They talk about the same kind of thing. So Medigap or Medicare Supplement is the exact same kind of insurance. So what is it? So Medigap insurance are private insurance policies that are sold by private insurance companies, but they are solely and specifically designed to supplement the costs that Medicare Part A and Medicare Part B left over after they paid their part first, period. Let me say that again. Medicare Supplement Insurance, or Medigap, is a private insurance policy that you purchase from a private insurance company. that is solely and specifically designed to pay the balance that Medicare Part A and Medicare Part B left over after they paid their part first, period. So these policies are designed only to pick up a balance that Medicare may have left over after they paid for a medical service first. They are required to follow all federal and state laws that are designed to protect you. If you purchase a Medicare supplement insurance policy to go with your original A and B of Medicare, that policy, that written policy, must say Medicare supplement insurance, those 3 words in that order for it to be legitimate. The phrase Medigap comes from the thought process that it covers the gaps in your Medicare coverage, i.e. the costs that Medicare left over. Medicare supplement insurance policies are standardized, meaning there are a set number of levels of coverage that you can choose from, and those levels of coverage are set in stone nationwide. So any company that sells this kind of insurance anywhere in the country sells the same set levels of coverage. They cannot change them or alter them in any way, with the exception of the 3 states listed that have additional levels of coverage to choose from. And the cost for this kind of insurance will vary by plan level, by company, by zip code, by whether you're male or female, smoker or non-smoker. So there are a lot of variables that go into how these insurance plans are priced. And we're going to talk about that a little bit as well further on. So this kind of coverage, Medicare supplement or Medigap coverage, only works if you have original Medicare A and B. If you have other types of coverage, you would not necessarily need or want to look at getting a Medigap policy. For example, if you are already enrolled in a Medicare Advantage plan or some other type of Medicare plan, such as a Medicare savings account, which we don't have in Colorado, unfortunately, or if you have other creditable coverage, you would not necessarily need this kind of plan. For example, if you are retired military and you are enrolled in TRICARE for Life, or if you have a retirement health benefit through an employer, such as a para-retiree, or if you're a federal employee, or even if you get it through private company. In this scenario, because original Medicare A and B is still your primary insurance, it is the first payer for any medical claims, and Medicare is a federal nationwide benefit, health benefit, that allows you to go to any doctor, hospital, or provider that accepts Medicare anywhere in this country without question for any medical need that you ever have. So it's also considered the most portable option for insurance once you're eligible and enrolled in Medicare, because it's good anywhere in this country with any provider that will accept it. Because it's good anywhere, and it's Medicare is your primary insurance, when you buy a Medigap policy, it will also go wherever Medicare goes. So who can buy it? Well, again, anybody who enrolls in this kind of policy must be enrolled in both Medicare Part A and Part B. Which is the best time to enroll in a Medicare policy, because it provides you with what they call a guarantee issue period. And that guarantee issue period means that you can't be turned down to get this kind of insurance, or outside of that, you would have to be able to pass underwriting, meaning you would have to answer health questions. And if the insurance company didn't like the answers, they wouldn't have to sell you insurance. In Colorado specifically, Medigap policies are also available for purchase with guarantee issue in certain situations for people who become eligible for Medicare who are under age 65. Primarily, that's going to be people who have been determined to be disabled through Social Security and have received at least 24 disability income payments. If you've received 24 disability income payments through Social Security, you would automatically become eligible for Medicare at any age. Otherwise, you would have to be age 65 to be eligible for Medicare, like we talked about last week. And if you're in that scenario and you're looking to purchase a Medigap policy to go with your A and B of Medicare, keep in mind that because you are under age 65, your premiums are likely to be more expensive. On the other hand, if you are under 65 when you become eligible for Medicare, you would get a second opportunity to be guaranteed issue into this kind of insurance, this Medigap policy, when you age into Medicare at 65. So you get an opportunity to get a Medigap policy when you first become eligible at any age, and then again when you turn 65. And a lot of people wait until they turn 65 because the premiums go down when you turn 65. But Medigap policies do not have enrollment periods. You can purchase a Medigap policy at any time for any reason, as long as you're able to pass underwriting, meaning you're healthy enough for the insurance company to want to sell you a policy. Otherwise, the best time to buy this kind of insurance to go with your Medicare would be during what they call, again, a guarantee issue period. The guarantee issue period is initiated when someone is enrolled in both Medicare Part A and Part B. So if you're someone who has worked past age 65 and you enrolled in Part A only when you turn 65, but you didn't enroll in Part B because you were still working, your guarantee issue period does not start until you enroll in Part B so that you have both A and B. So again, you have to have both A and B to be eligible for this kind of coverage. And when you turn 65 or when you are first enrolled in both A and B of Medicare, your guarantee issue period, the clock starts ticking on that guarantee issue period and starts the first day of the month your Medicare A and B kick in, or you have both A and B, and it lasts for 6 months. And once that 6-month clock starts ticking, it cannot be stopped. So once you have A and B of Medicare, you have a 6-month window to be guaranteed issue into a Medicare supplement. And what that means is you cannot be turned down by any insurance company for any level of coverage you choose, period. They will ask health questions on the application, but they cannot make you do a physical. You only have to answer the questions, but they cannot hold those answers against you. Once that guarantee issue period expires, there are very, very few scenarios that would allow an additional opportunity to be guaranteed into this kind of coverage. Outside of a guarantee issue period, again, you can try and purchase this kind of coverage at any time. No enrollment periods, no annual enrollment periods at all, as long as you can pass underwriting, meaning you're healthy enough for the insurance company to want to sell you insurance. So there are few and far between, but there are other opportunities where you might have a guarantee issue into this kind of coverage. And typically any special enrollment period that this would fall under is going to involve involuntary loss of some other kind of health insurance coverage. So for example, if you were enrolled in employer coverage and you stopped working and that employer coverage ended, because you had that employer coverage and it's considered creditable, meaning it's acceptable coverage in place of Medicare or Medicare supplement, when that coverage ends, you would have a short window of guarantee issue to get into a Medicare supplement without question. If you are already retired, but you have health insurance through that past employer, and suddenly that health insurance coverage, the employer just decides to stop insuring you, and you have to go and find your own coverage now. That's considered a involuntary loss of other creditable coverage. And that would include COBRA coverage. The other opportunity that most people might fall under for an additional guarantee issue period into this kind of insurance involves Medicare Advantage plans. And we'll talk about that in much more detail when we get to the next section and talk about Medicare Advantage plans. But those are the two primary scenarios that you might fall under to get an additional opportunity to get into this kind of coverage without question. So again, this kind of insurance coverage is designed to pay whatever balance Medicare left over after Medicare paid their part first for a covered service. If Medicare does not pay for a service, the supplement will not pay the balance or not pay the bill. So it's only designed to pick up what Medicare left over. It's not designed to pay in place of Medicare. So if Medicare denies a claim, the supplement will also deny that claim. It's only supposed to pick up whatever Medicare left over. There are other services that this kind of policy will not pay, and those are primarily going to be services that Medicare would not pay at all. And that's going to include long-term care. Dental and vision, of course, are not benefits of Medicare at this point, so it would not pick up those costs. Hearing aids, private duty nursing, or outpatient prescription drugs, because that would fall under, of course, Medicare Part D. So again, this is not going to be something that is going to pay in place of Medicare. It's going to supplement Medicare and cover whatever Medicare left over. So this handout is included in the email that I sent out earlier this evening. This is one of two handouts regarding Medicare supplements. And this handout is outlining the different levels of coverage you have to choose from for a Medicare supplement. And I apologize. Let me see if I can find a larger version of this for you. Give me just a sec. Maybe not. My apologies. So again, but this handout is included in the email I sent. So this handout shows you the different levels of coverage for a Medigap policy. Those levels of coverage are called plans, not to be confused with Medicare parts. So Medicare has Part A and Part A, Medicare has Part B, Part D for drugs. Supplements have plans, and those plans are labeled A through N, like the alphabet. Not a sequential alphabet, but A through N. And each plan level, as you go up that alphabet, is going to include some additional benefits. So the higher you go up in the alphabet, the more benefit you're buying. For the levels of coverage that you want to look at, when you look at this chart, you're going to notice that all plans are going to cover some benefits after Medicare, such as what they call basic benefits, which is for Medicare Part B services, the 20% Medicare leftover after they paid their part first for all your outpatient stuff. Most all of these plans will cover your inpatient Part A hospital deductible every time you're admitted to the hospital, every plan except for Plan A. Every plan except for Plan A and B will cover skilled nursing facility coinsurance. So if you remember last week when we talked about Part A benefits, Medicare Part A will cover all costs for skilled facility rehab care after a 3-day or longer hospital stay for the first 20 days. And then starting at day 21, if you're still in that rehab, Medicare pays everything except for $200 per day. Every supplement plan, except for Plan A and B, will pay that $200 a day for you. Some of these plans will also cover foreign travel emergency, which is not really a benefit, it's more of a reimbursement situation. Medicare benefits, once you cross the border or boundaries of the United States of America and or our territories, Medicare benefits stop. They stop at the border. So they're not good outside of the United States. So if you happen to be traveling outside of the United States and you have a Medigap policy that includes foreign travel emergency coverage, what that means is if you have a medical emergency outside of the United States or our territories, you pay for that emergency while you're there. But when you get home, you can submit the receipt or that bill for that medical emergency outside of the United States. to your supplement insurance, and they will tell you, go bill Medicare first. So they're going to make you bill Medicare first to get a denial that says Medicare is not going to pay for it. Then you submit your receipt and the Medicare denial to the insurance company, and they are supposed to reimburse you 80% of the cost of that medical emergency after a $250 deductible. So it's not a benefit that you could access while you're outside of the United States, but it would be some cash reimbursement for the cost of a medical emergency outside of the United States. There is also one plan. Well, actually, there's two, but for most people who have turned 65 or turning 65 after January 1st of 2020 will only be able to access one plan, and that would be Plan G. That also covers an additional benefit called Part B Excess. Part B Excess is referring to the way doctors get paid by Medicare for Part B services. And there are two primary ways that doctors get paid by Medicare or participate in billing Medicare. So when you have Medicare, original Medicare as your primary insurance, and you go to the doctor for just, say, a regular office visit, that doctor is going to bill Medicare, his usual and customary charge for an office visit, which let's say $300. So that doctor is going to bill Medicare $300. When Medicare gets that claim, Medicare is going to turn around and say, this office visit is only worth $100. So Medicare is going to reduce the $300 to $100 and pay 80% of the $100 amount. If you have a Medigap policy, your Medigap policy under basic benefits will pay the other 20% of that $100. So the doctor will get paid a total of $100. In this scenario, this doctor gets paid directly from Medicare and directly from your Medicare supplement insurance. That's because this doctor accepts Medicare assignment. This doctor accepts whatever dollar amount Medicare assigns for his services as payment in full. So even though the doctor billed $300, that doctor knew that they were only going to be allowed $100, and they were okay with that. They cannot bill you the difference between what they billed Medicare and what Medicare allowed them. So that doctor takes Medicare assignment. He takes whatever Medicare says he's going to get paid and accepts that as payment in full. The other kind of primary doctor or Part B doctor that you can go to does not accept Medicare assignment, and it works just a little bit differently, but not that much differently. So say you go to a doctor that does not take assignment with Medicare for a regular office visit. That doctor also has a usual and customary charge of $300. So that doctor is going to bill Medicare $300 for that office visit. Medicare is still going to turn around and assign $100 and pay 80% of that. The supplement will get a bill for the other 20%, and they're going to pay the other 20% of that. The difference is when you go to a doctor that does not take Medicare assignment, that doctor is allowed to charge 15% more than what Medicare assigned for that service. Medicare already has a predetermined dollar amount for any and every service you could ever receive. So doctors can predetermine how much they're going to get paid for a service and add 15% on top of that. And then that doctor is going to ask you, while you're at the office, to pay that $100 plus 15%. So they're going to ask you to pay upfront $115. That doctor is still going to bill Medicare. Medicare is still going to pay the claim. But when Medicare gets the claim, they're going to see that that doctor does not take assignment. And Medicare is going to assume that you paid that doctor $115 upfront. Medicare is still only going to reimburse. So Medicare is going to process that down 80% of $100. And they're going to send you a check for $80. And then they're going to send the balance of $20 to your supplement, and the supplement's going to send you a check for the other $20 so that you get reimbursed $100. But if you have the Plan G that includes that Part B excess benefit, that Part B excess benefit will also reimburse you that extra 15% the doctor made you pay upfront. So you would get reimbursed everything that you paid upfront if you have a doctor that does not take assignment. And that's basically going to be the difference between a doctor that charges you upfront, even though you have Medicare, and a doctor that just relies on Medicare to reimburse them directly. And again, there's only that one Plan G that provides that benefit through your supplement. Now, you may notice that there are two plans that are kind of grayed out, Plan C and Plan F. Those two plans are no longer available for people to purchase or enroll in for anybody who turned 65 after January 1st of 2020. So if you were eligible for Medicare by turning 65 prior to January 1st of 2020, you would have the option to purchase a Plan C or a Plan F. But if you turn 65 after January 1st of 2020, you do not have the option to purchase either of those plans. The only difference between those two grayed out plans and the plans they're sitting right next to, D and G, is that the C and F plans also paid the Medicare Part B annual premium. Again, that's $226 this year. Those two plans paid that annual deductible. And after 2020, if you became eligible for Medicare, you no longer have the option to purchase a plan that includes that benefit. So I will take a break here to see if there are any questions. Again, if you have a question, you can type it into the chat box, or you're welcome to simply unmute and ask your question now. All right, I'm not seeing any questions in the chat, and I'm not hearing anybody ask, so we will move on. So that chart just outlined the different levels of coverage you have to choose from. The other handout that I included in the email that I sent earlier today is this one. And this one is put together by the Division of Insurance up in Denver. And we are very, very lucky here in Colorado that our Division of Insurance takes the time and energy to put this document together, because not all states get this. And what this document is a list of all of the companies licensed to sell this kind of insurance in the state of Colorado. It lists those companies in alphabetical order and by age group. There are over 40 companies licensed to sell this kind of insurance in Colorado alone, and that varies from state to state. So the first half of this handout, the first half of this multi-page handout is going to give you a little bit of information about everything I just talked about. Guarantee issue, enrollment periods, that kind of stuff, when it's best to enroll, different plan levels, etc. The second half of this handout is going to be these charts. These charts are going to be grouped by age, starting at age 65. Each page or each age group is going to have 2 pages, or front and back pages. Again, each company that's licensed to sell Medigap coverage in Colorado is going to be listed in alphabetical order along the left-hand side, including their phone number. It's going to tell you, it's going to separate the information between male and female. It's going to tell you whether or not there are any other provisions that you would need to be aware of. And there's a key code on the previous page to where these charts start that give you an idea of what those key codes mean. And then you're going to see A through N across the top of the page. And that's going to represent the chart that we just looked at. And if you intersect a plan, such as Plan G, so you go up to the top to Plan G, and you say go down the column to Anthem Blue Cross Blue Shield supplement company. If you intersect where Blue Cross meets Plan G, if there's a number in that box, that number represents an approximate monthly premium for that plan with that company for this year. Now, you may notice on this handout that it says September of 2022. That is the most current document available. This handout doesn't come out until between July and August each year, or July and September each year. So it always comes out mid-year, and premiums do tend to increase or change at the beginning of each year. So this document is is not designed to give you actual price quotes. It's designed to give you a ballpark idea of what each company charges for each plan that they provide or carry, so that you can kind of compare apples to apples between the different companies. Now, remember, earlier in the presentation, I said that these plans are set in stone. What that means is every single company on this list sells the exact same A through J plans or A through N plans that are outlined here. So every company is selling the same plan G or the same plan N or the same plan D. They cannot alter these plans in any way. So they're all selling you the same product. But the price does vary from company to company based on a number of factors that I mentioned, such as whether you're male or female, your age, your zip code, those kinds of things. So prices can vary significantly between these companies for the same coverage. But keep in mind always that a plan G is a plan G is a plan G, no matter who you buy it from. So it does pay to shop around. And again, this handout is not going to give you exact price quotes, but it is going to give you an idea of what companies charge more and what companies charge less for the exact same coverage. There is no advantage to paying more for a plan with one company versus another company. You're not going to gain anything. They cannot add to these plans. They cannot give you extra benefits or incentives. What they charge is what they charge, and you're going to get exactly the same benefit no matter what you pay. So again, it does pay to shop around. And this chart is going to help you determine what companies you don't want to shop around with because they're going to be too expensive, and what companies you would want to contact to get more information. Again, not going to be price quotes. They're going to be estimates in the ballpark of what you might pay at age 65. Or if you go to the next page, age 70, or the next page, age 75, obviously the price is going to increase the older you are when you're purchasing this coverage, but it's going to give you an idea of who charges more, who charges less. So it's going to be a tool. It's not going to be the final word. And for anybody who is getting ready to turn 65, anytime in the next 6 months, you are probably already being inundated with junk mail. And some of that junk mail, if it's coming from a company that's trying to market a Medicare supplement policy to you, in that junk mail, they're probably going to have a specific premium quote for whatever plans they sell for someone turning 65 in your area. So even though it's junk mail, if this is the kind of coverage you're interested in, you might open it just to see if it includes a price quote for the plans that they offer. Otherwise, it will be your job to make some phone calls and get exact price quotes for the plan that you decide you want with the companies that you might be interested in. Now, when it comes to this kind of coverage, I always encourage people to pick your plan first, decide what level of coverage you want and will be comfortable with for the long haul, for years and years and years, because this kind of coverage is not the kind of coverage, again, that you'll have an annual opportunity to change. Again, there's no annual enrollment period for this kind of coverage. When you first become eligible and enrolled in Medicare, you get that 6 months of guarantee issue. And then outside of a special enrollment opportunity based on loss of other coverage, this is going to remain static. It's going to stay the same. So this is not the kind of coverage that you're going to be able to change or review on an annual basis to change. All right, so I think that's all about Medicare supplements. Before we move on to Advantage plans, are there any questions? Okay, I do see a question. Can you explain how community rated premiums are different between ages? I thought community rated meant everyone paid about the same. So in the past, community rated basically meant, and there was one company that used to be community rated in Colorado, and that was AARP. They aren't anymore. But what that meant with AARP is that no matter what age you were going to pay the same premium for the plan that they offered. So AARP offered most of the plans on the chart, A through N, and everybody, regardless of age or health, paid the same rate. And they didn't underwrite. So you could be on the operating table getting brain surgery and they would sell you a Medigap policy anytime, anywhere. These days, what community rating means is not that. Community rating usually means that they are more generous with their premiums for age groups, but it's not going to be the same as everybody pays the same in the same area. So the other types of ratings or premium ratings that you can encounter are going to be annual, or what's the word I'm looking for? I lost the word I'm looking for. So you either got I can't think of the word. I'm sorry. There are two other ratings that most policies fall under, and that's going to be attained age and issue age. Thank you very much. I totally lost the word right there. So attained age and issue age. And the difference between those two ratings, which are going to be the most common, are whether or not the company bases premiums on the age you attain. So you attain age 65, you attain age 70. So your premiums are going to be based on aging towards that, versus issue age, which is going to be based on the age you are when you purchase that policy, such as age 68. How is that different between attained age? Well, that's an insurance thing. And insurance companies are really good at coming up with different factors that they can add into the calculation on how they calculate premiums. Typically, if you have a policy that is attained age, the premium may go up a little more quickly than with other types of policies, such as attained age. So that would be something that if you call up any of these companies and you're talking to them, that might be something you ask them. I typically encourage people to ask a company when you're talking to them if they can tell you what kind of premium increases that company has had to their supplement plans in the last 5 years, to get an idea of what kind of premium increases they've had over that time. Will give you sometimes a good idea of what kind of premium increases you might be looking at in the future. Medicare supplement insurance is like any other insurance. You can count on a premium increase at least once a year with this kind of coverage, just like any other kind of coverage. Typically, the state will approve 6 to 15% annually. Rare occasions, a company might ask for a higher premium increase, but they would have to have a good reason for the state to approve that. And the state does have to approve all premium increases. They have to vet all increases every year. So keep that in mind as well. But be sure to budget for these kinds of increases on an annual basis at minimum. So hopefully that answers your question.
Roma, I have a question.
Sure.
So when shopping for supplemental plans, besides calling the company and getting who knows what sales pitch, are there independent resources that compare these supplemental insurance companies to each other?
When you say compare, do you mean?
Well, things like customer service and the quality of the company in terms of their rating on their risk rating and that kind of thing.
So the only way that you can get that information probably, and in the handout that I showed you the cover of, that multi-page handout,
Yeah.
it does list like 3 websites, the AM Best, the S&P, and there's another financial rating website that you can go to kind of see the financial history of these companies and what their ratings are. Otherwise, there's not really, that I'm aware of, any place you can go to get that information. But you
Is
can
it
go.
Sorry. Is it your feeling that engaging in such a comparison is a waste of time, that because the plans are substantially the same, that there's really no point in going through the effort?
You know, honestly, because all of these companies sell the exact same thing, they're all selling you the same product. They're all required to follow Medicare rules and guidelines and regulations, so they can only do one thing. And that's what the plan outlines it's supposed to do based on what Medicare paid. The plan has to pay this. So there is no wiggle room for them to have to do anything else. So when they get a claim from Medicare, they pay the claim. So I haven't had to call a supplement insurance company about not paying a claim or customer service or anything like that in probably 20 years, as I've been doing this a long time.
Well, Roma, that's very useful. Thank you for telling me that.
You're welcome. Any other questions or concerns? All right. As you know, always, you guys are welcome to reach out to our organization. If you do have any questions after the fact and you think of something you wanted to ask, a couple of days from now, you're always welcome to shoot me an email, and my contact information will be at the end of the presentation. Or you can just reply to the email that I sent out earlier today, and I'm always happy to answer any questions in the meantime. It does look like we do have another quick question. Can you change companies, supplement insurance companies annually? Can you change plans, like from a plan C to a plan G? That's a good question. Again, Medicare supplement insurance policies, there is no annual enrollment period. There is no annual opportunity to compare plans and make a change if you want. Because these companies are allowed to underwrite outside of guarantee issue, when Medicare dictates they have to sell you whatever you want, regardless of your health. That's your guarantee issue period. Outside of those guarantee issue periods, again, you can try and enroll in any plan with any company at any time. But you will be underwritten outside of a guarantee issue or special enrollment period, meaning you have to answer the health questions on the application. And if the insurance company doesn't like the answers, they're simply going to not sell you insurance. And that applies at all times outside of guarantee issue opportunities. That also applies if you're trying to change from one plan level to a different plan level, even within the same company. You are subject to underwriting, and if they don't like the answers to the health questions, they are not going to let you change to a different level of coverage. On the other hand, once you're enrolled in a plan like this, you're guaranteed to remain in that plan for as long as you pay the premiums. They will continue to have to cover you at that level of coverage that you purchased without question for as long as you have it. The only way they can drop you is if you stop paying your premiums. So a follow-up question, what if a company goes out of business? Are you grandfathered? That's also a very good question. Medicare has regulations in place that are designed to make it so that you are never in a situation where you are uninsured or uninsurable through something like that, such as a business goes belly up and you lose your policy. In a situation like that again, it would be considered involuntary loss of coverage, and you would have a special enrollment opportunity with guarantee issue to get another plan from any other company of your choice without question. So again, that what if the company goes out of business? That falls under involuntary loss and provides you a guarantee issue into other coverage with another company. So Medicare's whole goal is to not leave you in a situation where you're uninsured or uninsurable through no fault of your own. Again, the only way any of these companies would be able to drop you from a policy is if you stop paying the premiums. That's the only reason they could drop you. So you're guaranteed, this policy is guaranteed renewable for life. So unfortunately, you don't get that opportunity to compare plans and jump to something cheaper from one year to the next unless you're healthy enough to pass underwriting. So hopefully that answers your question. All right, any other questions? All right, so let's move on to Medicare Advantage plans. Medicare Advantage plans are going to be the other option that everybody has when they become eligible and enrolled in Medicare, and they are a totally different animal than Medicare supplements. So Medicare Advantage plans, When someone enrolls in that plan, that is a private plan, that is a plan that's offered by a private insurance company, but that company has contracted directly with Medicare, meaning Medicare pays them to provide Medicare benefits to you. So basically, Medicare is going to pay a private insurance company to act as Medicare for you if you enroll in that plan. When you enroll in an Advantage plan, keep in mind you still have original Medicare. That never goes away as long as you're paying your Medicare premium. But an Advantage plan replaces your original Medicare and becomes your original Medicare. So it takes over your Medicare benefits and provides all of those benefits through that private insurance company. But original Medicare never really goes away, and you still have to pay your Medicare premium. And if you ever get out of the Advantage plan, your original Medicare is automatically right there to take over. In an Advantage plan, you will still have all the rights and protections of original Medicare. You will still get all services that are covered under original Medicare through the Advantage plan, but they're called Advantage plans for a reason, and that's because these plans are allowed to offer extra benefits or supplemental benefits above and beyond what original Medicare covers. For example, it may cover routine vision services or hearing, it may cover dental services. Free gym memberships were the biggest seller back in the day when these plans first started coming out. These plans have been allowed to continue to add to the types of extra services that they are allowed to offer to Medicare beneficiaries who enroll in their policies. And we'll talk a little bit about that as we go on. But the extras are what really sell these plans these days. Most Advantage plans will include prescription drug coverage, Medicare Part D, as part of the package at no extra cost. When you have original Medicare as your primary insurance and a Medicare supplement as your secondary insurance, you have to purchase Medicare Part D in addition to those. If you have an Advantage plan, everything's rolled up into one ball of wax and under the management of one insurance company. So there are pros and cons to each type of option that you can look at. There are also additional eligibility requirements to enroll in an Advantage plan. And the primary eligibility requirement is you must live in the plan's service area. And for all intents and purposes, that is going to be your county of residence. So if you live in El Paso County, you have to purchase a Medicare supplement or enroll in a Medicare supplement that is available to enroll in your county. And the plans that are available to enroll in El Paso County may be different than the plan choices in Teller County or Denver County. So you have to enroll in a plan that's available in the county that is your primary residence. You must have both A and B of Medicare to enroll in an Advantage plan. But there are enrollment periods, annual enrollment periods, or eligibility periods when you can enroll in this type of coverage. And there are typically multiple opportunities in a year for you to do that. So when can you get into this kind of coverage? Well, there are, like I mentioned, several opportunities for you to review this type of coverage, and if you choose to do so, switch from one plan to another. The primary enrollment period is going to be your initial enrollment period, and that is going to be the same enrollment period as for enrolling in original A and B of Medicare when you first become eligible, which is typically going to be surrounding your 65th birthday. It's the 3 months prior to the month of your birthday, the month of your 65th birthday, and up to 3 months after the month of your 65th birthday. So it's the same initial enrollment period as for enrolling in original Medicare. So you get the same opportunity that when you're enrolling in Medicare, you can also choose to enroll in an Advantage plan to be effective at the same time. Then other opportunities to enroll in a Medicare Advantage plan or to switch from one to another are going to be the annual election period, which is most oftenly referred to as simply open enrollment. There's a newest enrollment period called the annual Medicare Advantage open enrollment period. And then there are always special enrollment periods for people who fall under specific situations. So we talked about the initial enrollment period, which surrounds your initial eligibility into Medicare. The annual election period, again, we simply always refer to it as open enrollment. That is the annual period. That's the longest running enrollment period. That's October 15th through December 7th every year. And during that time frame, you can review other plan options that might be available for the next year for both Medicare Advantage plans and Medicare Part D plans, standalone plans. So during that October 15th through December 7th window, you can look at getting into an Advantage or Part D plan, getting out of an Advantage or Part D plan, or switching from one Advantage to one Part D plan to another. So it applies to both types of coverage, Advantage and Part D. Any change that you make or any enrollment that you make during this window of opportunity goes into effect January 1st each year. The newest enrollment period, the Medicare Advantage open enrollment period, applies only to people who are enrolled in an Advantage plan on January 1st of each year. So if during the October through December enrollment period you chose to enroll in an Advantage plan for the first time, that enrollment goes into effect January 1st. Come January 1st and through March 31st, you would have an additional opportunity to change your mind. So if you decide at the last minute that maybe that's not the Advantage plan you really wanted in the fall, during this period of enrollment, January through March 31st, you can either switch to a different Advantage plan, or you can get out of your Advantage plan altogether and go back to A and B of Medicare as your primary insurance. If your Advantage plan included a drug benefit, because most of them do, it would also allow you, if you decide to get out of Advantage plans altogether, it will allow you the opportunity to get a standalone separate Part D as well, so that you're not without drug coverage when you drop that Advantage plan. So, but again, you have to be enrolled in an Advantage plan on January 1st to take advantage of this enrollment period, and it allows you to either switch to a different Advantage plan one time during this 3 months, or get out of Advantage plans altogether and get back to original Medicare and a separate Part D. If you are not enrolled in an Advantage plan on January 1st, this enrollment period does not apply to you, because that's the only things that you can use that period for. And then, as with most things Medicare, there are always special enrollment periods or special opportunities to make changes. The most common special opportunities surrounding Advantage plans, I mentioned a few minutes ago that when you enroll in an Advantage plan, you have to enroll in a plan that's available in the county that you live in. But what if you move out of that county? Say you move from Colorado Springs to Woodland Park. You cannot take that plan with you. It stays in the county you enrolled in it. So because when you move from one county to another or from one state to another, because you can't take your Advantage plan with you, that is considered involuntary loss of coverage. It's not your fault. And what that provides you is an opportunity to enroll in another Advantage plan when you get to the county you're moving to, and whatever options they are offered in that county. Or it gives you a short window of opportunity to be guaranteed issue into a supplement. So again, if you are enrolled in an Advantage plan and you move out of the county you live in and you can't take your plan with you, when you get to where you're moving to, you can enroll in whatever Advantage plan might be available in that county, or you would have a short window of guarantee issue to enroll in a Medicare supplement without underwriting. So that's one scenario. The other scenario involving Advantage plans and special enrollment would be what they call the test drive or trial right is the other term for it. So Medicare Advantage plans have exploded onto the market in a relatively short period of time. Medicare supplements have been around forever, but Medicare Advantage plans really have exploded onto the market literally in the last 7 or 8 years. And especially in the last 3 or 4 years, the number of plan options for Advantage plans in any state has almost quadrupled. Because these types of plans have increased so quickly, there is a lot of confusion surrounding how these plans work. And unfortunately, when these plans started to increase on the market, a lot of people were enrolling in this type of coverage without really understanding what they were enrolling in. Or even more unfortunately, they may have been misled about what they were enrolling in. And when they realized what they actually got when they enrolled, they weren't too happy about it. And that happened often enough that Medicare had to create a rule. And what that rule says is that if you try an Advantage plan, if you enroll in an Advantage plan when you first become eligible for Medicare at 65, and you get into an Advantage plan from the get-go, Medicare is going to give you a 12-month period to test drive that plan to see if it's going to be the type of coverage you're okay with for the long haul. So if you enroll, again, you have to enroll in an Advantage plan when you first enroll in Medicare at age 65. And if you enroll in that Advantage plan, you get up to 12 months to try this kind of coverage out. And if at any point within that 12-month window, you decide that this coverage is not for me, you can drop it, even if it's outside of an enrollment period, and still have guarantee issue into a Medicare supplement. So it kind of almost extends that 6-month window of guarantee issue into a Medicare supplement for an additional 6 months, but only if you enroll in an Advantage plan when you turn 65 and get Medicare. So again, it gives you an opportunity to have guarantee issued into a Medicare supplement if you decide to drop the Advantage plan within that 12-month window. If you stay in that plan longer than 12 months, then the only other opportunity you'd have to get out of that plan would be during the next annual enrollment or open enrollment period. The other way that would work is if when you turn 65 and enroll in Medicare, instead of enrolling in an Advantage plan, you enroll right away into a Medicare supplement. And you maintain that supplement without any break in coverage for however many years. It could be 1 year, it could be 5 years, it could be 10 years. As long as you maintain that supplement policy without any break in coverage for any length of time, you would have an opportunity to drop that coverage during an open enrollment period and enroll in a Medicare Advantage plan because you want to try it out. In that scenario, you would still get a 12-month window to test drive that Advantage plan. But if at any point during that 12-month window you decided this is not what I want my supplement back, you're guaranteed to get the supplement that you dropped back without question. So, and if for some reason that supplement was no longer available, you'd be guaranteed to get the next best thing or get the same coverage from a different plan, a different company. So those are two ways you can kind of test drive either from the get-go or further down the road. But if you test drive it further down the road, you're only guaranteed back into the supplement you dropped. So keep that in mind. So any questions about any of that? No questions? It's all clear as mud. All right. So as with Medicare supplements, there are some out-of-pocket costs with these kind of plans. So when you enroll in a Medicare Advantage plan, there are out-of-pocket costs. Again, you still have to pay your Medicare Part B premium. There's no getting out of that. Most Advantage plans in this area, and I'm talking El Paso County in general, but most counties in Colorado, honestly, most Advantage plans have 0 monthly premium, meaning as long as you're paying your Part B premium that's coming out of your Social Security check, if you enroll in an Advantage plan, you will pay no additional monthly premium to have that plan. Some plans, there are a few plans that do have a premium, but those premiums tend to be lower than the premiums for a Medicare supplement. Medicare Advantage plans also have other out-of-pocket costs in the form of copays. So in exchange for that 0 monthly premium, you are likely going to have to pay a copay every time you walk into a medical provider's door. So you pay copays for services as you go. You may also have deductibles with Advantage plans, or even co-insurances where you have to pay a percentage. And that's typically going to be for more expensive or more in-depth medical services. So these plans work, again, they work differently than Medicare supplements. Again, you will always get all the Medicare covered services that original Medicare includes, but it's through the plan itself. Again, most plans will include drug coverage. There are some plans that do not include drug coverage, and those are typically marketed to people who do not need a Part D plan or a Part D benefit, because you have drug benefit available through another means, such as VA pharmacy or something like that. In these kinds of plans, you may be limited to what providers you can go to and what facilities you can go to. Although in a medical emergency, the plan would have to cover you anywhere in the US with any medical provider in an emergency. Outside of an emergency, you may be limited to seeing doctors and providers and going to medical facilities in the county that you live in. And again, benefits and cost sharing are different than original Medicare and a supplement. And just to make things a little more interesting, there are many different kinds of Advantage plans. You've got HMOs, or health maintenance organizations. You got PPOs, PFFSs, or private fee-for-service plans. You've got special needs plans. And then they have just this year come out with even another type of plan called point of option, which is kind of a hybrid type of benefit that they've tacked on to already existing types of plans, such as an HMO POS or fee-for-service POS. And we'll talk about that a little bit. So there are other types of plans that fall under the heading of Advantage plans, and that includes Medicare savings accounts. We're not going to talk about them because no company sells them in Colorado. We don't currently have any demonstration or pilot programs in Colorado. We do have PACE. PACE is basically going to be a Medicare Advantage plan, but for a specific population of people who are Medicare and long-term care Medicaid. If you want a complete listing of all plans available in all areas of Colorado, you can find that information in the back of the Medicare and You handbook each year. But you would have to look at the handbook specific to Colorado or whatever state you're in. And it will list all the Advantage plans available in that state and all the Part D plans available in the state. If you want that information, you can call 1-800-MEDICARE and request that they mail you a hard copy of the Medicare and You handbook, or you're welcome to shoot me an email or give me a call. We do have a couple of cases at the office, and we're happy to provide those to you as well. So real quickly, because I know we're probably running over time, I'm going to go through how the different types of plans work, starting with HMOs. If you've ever been in an HMO, you know what I mean when I say an HMO is an HMO. They work the same way, whether it's through an employer, private insurance, or through Medicare. HMOs are the most restrictive type of plan, where you are required to only use providers and facilities in a network for that plan, meaning that plan has contracted providers and facilities, and those are the providers you have to use. You may be required to get referrals to see specialists. You may be required to get prior authorization for some services. HMOs are usually going to include drug coverage at no extra cost. But if you go outside of the network's providers or facilities, the plan will not pay for that service. You have to use the network of providers and facilities they contract, or you don't have coverage. PPOs are a little more flexible. They have a network of providers and facilities that they've contracted that they would prefer you use, but you're not limited to that network. So if you decide you want to see a provider not in the PPO network, and that provider agrees to accept your PPO insurance, you can see any provider you want. But in that scenario, you will pay a higher copay to see that out-of-network provider. Because they allow you to go out of network, you're not going to be required to get a referral to see a specialist, but you may still be required to get prior authorization for some services. PPOs may or may not include a Part D benefit. If it does not include a Part D benefit, it's because you have other creditable coverage and you don't need Part D. Otherwise, you would not be allowed to purchase a separate standalone Part D plan. Fee-for-service plans were designed to be the least limiting option, meaning if you were enrolled in a fee-for-service Advantage plan, you could go to any doctor or any facility that agreed to accept your plan. The problem with that is that there were agents out there selling this plan to people in areas where no doctor would accept it. So they were selling it in counties where none of the doctors took that plan. So again, Medicare had to step up and make a rule, and now these types of plans are required to have at least one contracted medical provider and facility in every county. But because you can otherwise go to any doctor or provider that is willing to accept your plan, no referrals are required, although some prior authorization may be required for some services. The plan is still going to determine your copay with any provider. But the downside of this kind of coverage is that because there's no contract holding these providers to the plan, if a provider accepts you for one visit and then decides they don't like what they got paid, they don't have to accept you for the next visit. So they can take you on a case-by-case basis. These plans also may or may not include Part D drug coverage, but if you get a fee-for-service plan without Part D drug coverage, you would be allowed to purchase a separate standalone drug benefit so that you had drug coverage. Special needs plans are going to be Medicare Advantage plans that are primarily HMO based, but they're going to be for very specific populations, primarily for people who have Medicare and long-term care Medicaid, or if they live in long-term care facilities, or if you have qualifying health conditions, usually multiple health conditions, major medical health conditions to qualify. These types of plans are not available in all areas. And again, you could look at the Medicare New Handbook or call 1-800-MEDICARE or come talk to one of our SHIP counselors, and we'd be able to help you get more information if you wanted it. Again, PACE program, also HMO modeled, also for a very specific population of people with Medicare and long-term care Medicaid eligible. PACE program is kind of an HMO on steroids because it's designed to provide additional support and managed care for that population so that they are able to maintain their independence and stay in the community longer versus having to go into an assisted living or skilled facility, long-term care nursing home. So that's the different types of plans. If you enroll in an Advantage plan, keep in mind you do have rights. You have rights to access healthcare providers that you need. And if you ever come across a situation where your plan is not able to have a provider for you to go to treat your need, you need to let Medicare know. You need to call a SHIP counselor. You need to call 1-800-MEDICARE and let them know that your plan is not able to provide you with services that you need. You have the right to know how your doctors get paid. You have the right to fair, efficient, and timely appeal processes and expedited appeal processes in certain situations. You have the right to always get the services that you need. You have the right to get information about your plan and your coverage in easy to understand language. And of course, you have the right for your Medicare or your personal medical information to be kept private. I mentioned a little bit that in some situations, insurance agents have caused Medicare to have to make rules. And typically that's not ever going to be a good thing. So there are a lot of rules regarding how these plans can be marketed to the public. And there are a lot of things that these kinds of insurance plans are not allowed to do. And that includes, that includes how they can market that to you, including where'd it go? Including whether it's through the mail, whether it's ads on TV, whether it's emails or telephone calls. All of that kind of stuff is regulated by Medicare, and there are lots of things that these insurance companies cannot say or do when it comes to trying to talk you into enrolling in these plans. So things that they can't do is they can't approach you in common areas such as parking lots or lobbies. They cannot send you unsolicited texts or emails. They cannot use the word free if they're trying to describe a zero premium plan. They cannot require you to sign in as a prerequisite of attending an informational event. So you don't have to sign any sign-in sheets because they're simply going to take that information and start marketing to you even harder. And they cannot camp out. They cannot have a table inside a doctor's office. They cannot misrepresent themselves to a beneficiary as working for Medicare or Social Security or anything like that. They cannot say that they're going to provide an educational presentation to tell you how Medicare works and then talk about the plans that they sell. If they say they're going to talk about Medicare, they have to talk about Medicare like I'm talking about Medicare. They cannot try and sell you anything. On the other hand, they can have a sales table set up just outside of that Medicare presentation so that when you walk out of that presentation, they can try and sell you something that they sell. They cannot feed you other than light snacks and drinks. They cannot offer free services or gifts or incentives greater than $15 in worth. And they cannot go door to door. That's a biggie. They cannot knock on your door. They cannot cold call you. Going door to door is a huge, huge no-no. They have to prearrange any type of contact with you. Things that they must do, they must submit any marketing material to Medicare for approval before they can put it out to the public. They must comply with do not call registries on your phone. If you want to have an appointment or talk to them about what they sell, they must obtain a permission to contact form from you where you sign it or you give verbal consent. And during that appointment, they must present a scope of appointment, meaning they're only allowed to talk to you about what your scheduled appointment was to talk about. Many times insurance agents sell more than just one product. So for example, if someone is selling Advantage plans, they may also sell annuities or life insurance or something like that. If you have an appointment with an agent to talk about Advantage plans, they're only allowed to talk about Advantage plans. If you find out they sell other products that you're interested in talking about, they would have to finish the appointment they have with you about Advantage plans and ask you to sign a scope of appointment that says now you want to talk about something else. And that's not very common knowledge, so keep that in mind. I did include a handout in the email that I sent that included some of this information. And anytime you have a question about your interactions with a representative or an agent or broker, please call us and we'll help you sort that out. So how do you pick one of these plans? Well, you need to ask yourself a couple of questions. If an Advantage plan that you're looking at includes Part D drug coverage, make sure that it covers your drugs. All Part D plans, and we'll talk about this in detail next week, all Part D plans and all Part D benefit through an Advantage plan has a list of drugs that they cover or a formulary, and every plan has a different formulary. So don't assume that just because you have a Part D benefit, a plan or benefit through Advantage plan, that is going to cover your drugs, because every plan has a different list of drugs that they cover. So you want to make sure that all your specific drugs are covered by whatever plan you choose. If you already have primary care doctor that you don't want to lose, you want to make sure that that doctor takes whatever plan you're considering enrolling in. Because if you enroll in a plan and you don't check with your doctor and they ultimately tell you that they don't take that coverage, you can't see that doctor anymore without paying out of your pocket. Do you doctor a lot? Do you see a lot of specialists? In some of these plans, keep in mind that you may be required to get a referral from your primary doctor every time you need to go see a specialist. So that would include 2 office visits and potentially 2 copays just to get to that specialist. A lot of these plans, again, include a lot of extra benefits that are services and benefits that are not covered by actual Medicare. And those are huge, huge selling points for a lot of people who want dental coverage, who want vision coverage, who may want transportation. There's any number of extra benefits that these plans can offer these days, and some of them are pretty impressive. Is that the primary reason to enroll in this kind of coverage? It depends on your situation. It depends on your health. It depends on your family health history. It depends on your financial situation. It depends on what area you live in. There's a lot of things that you'd want to factor in, but what I'm saying is I'm encouraging you not to make a plan choice based solely on the extras, because it ultimately might not be your best plan choice. Again, in the email that I sent out earlier, I included a couple of handouts. This handout, I love this handout because it gives you more detail about the differences between the different types of plans. And it gives you a little section for each plan description with the pros and cons. So it's kind of a wonderful reference to go back to when you're looking at these different kinds of coverage. And if anybody's interested, I have these handy dandy at a glance charts. I have them for El Paso, Park, and Teller counties. Unfortunately, I don't have them for any of my other 6 counties this year, but I'm hoping to include them next year. And this is going to list all of the Advantage Plan options available in each of those counties, El Paso, Park, and Teller this year. It's going to be at a glance. So it's going to tell you the plan name, and it's going to tell you if that plan has a premium. It's going to tell you what kind of plan that is. It's going to tell you if that plan has deductibles. It's going to tell you what each plan's copay is for primary doctor or hospital stay or skilled facility stay. So it's going to be a nice handy dandy at a glance where you can see multiple plans available in an area all at once, so that you're not, going back and forth between websites and that kind of thing. If anybody's interested in this handout for El Paso, Park, or Teller counties, shoot me an email and I'm happy to send that to you. And then the last thing we're going to talk about real quick is Medicare savings programs. This is a financial assistance program available specifically for people with Medicare. I may have brought it up briefly last week. This is a program designed to help pay Medicare expenses only. For example, it could help pay the Medicare Part B premium so that they don't take it out of your check. It's paid by the state. Income limits for 2023 for single people and for married couples. These limits are in gross pre-deduction dollars. It also has an asset limit for a single or a married couple, with some disregards. At the SLMB and QI levels, if you qualify under those income guidelines, you would qualify for the state to pay your Part B premium so that they don't take that $165 out of your check every month. At the QMB level, you would qualify not only for the state to pay that premium so it doesn't come out of your check, but it would also act very much like a supplement where it would pay your Medicare deductibles and the 20% for your Part B services, etc. But of course, you have to be at the lowest income level. If anybody wants any information or to talk about these programs in more depth, feel free to contact us. We're happy to help determine eligibility, and we do help with these applications. We also have a sister program I might have mentioned last week called S&P, Senior Medicare Patrol. This program helps educate and assist people who are suspecting fraud or abuse of their Medicare benefits. Always looking for volunteers as for both the SHIP and the S&P. I do S&P presentations that help educate on how to identify fraud and what to do if you find it. If anybody wants any additional information, you can call us and I'm happy to talk to you, or you can go to the smpresource.org website, which has a lot more information about how to volunteer and what the program does. And always looking for volunteers. If anybody's interested in learning more about Medicare or Medicare fraud and is interested in volunteering, please call me. It can be a very, very rewarding volunteer opportunity. And I know we ran over time, but that is all I have for you tonight. Any questions before I let you all go to enjoy the rest of your evening? You're very welcome. I see a couple of thank yous in the chat. I appreciate that. Hopefully I will see you all next week when we talk about specifically Medicare Part D, the prescription drug benefit of Medicare. There's actually a lot of good news on the horizon, so there'll be some updates in next week's presentation for 2024 and 25. So I look forward to you joining me for that information. And if there are no other questions or comments, I will let you all go and enjoy the rest of your evening. Again, if you didn't get the email I sent out earlier, shoot me an email or give me a call, and we're happy to get that to you. Otherwise, I will hand it back to Jared, I guess, and say thank you again and good night.
Nope. Thank you, Roma. I'll just add a little bit. This is the second of our 4-part series. As Roma mentioned, next week we'll cover Medicare Part D. You will receive a survey after this webinar is complete, and we greatly appreciate your feedback on your thoughts on how this webinar can be improved in the future. This webinar will also be available on demand tomorrow afternoon if you would like to review any of the content that Roma went over tonight. Thank you once again, and have a great day.
Night, everyone.